Greetings. Um, so we've talked about glucocorticoids, we've talked about prostaglandin, or the NSAID drugs, and how it relates to the arachidonic acids and that pathway. Well, within arachidonic acid, you have the arachidonic acid, which then goes through COX enzymes, and it actually gives you prostaglandins. And then you have prostaglandins, and you have different kinds of prostaglandins. Remember, you have prostacyclin, right? You have PGE1, and yeah, you have all these prostaglandins, right? There's actually a set of drugs that come out of these prostaglandins that are very specific to that prostaglandin and its function. And that's the set of drugs that we're going to talk about just to make sure you're good with that as well. So let's get going. PGI, or prostacyclin agonist. Remember, cyclin keeps the blood moving, decrease the clumping of the platelets. Remember, we covered this in anatomy and physiology, and causes what? Vasodilation. That's how it keeps that blood cycling. So any drug that will support this would do what? Vasodilate and decrease the clumping of the platelets. Okay. Ta-da! Iloprost. PGI. Iloprost starts with an I. That's how I remember it. PGI. Iloprost. I love Prost. Prostaglandin. Okay. And I love it. It loves prostaglandin I. Makes sense, right? That's how I remember it. Because it vasodilates. Yes, used for pulmonary hypertension, relaxes that blood vessel. Cyclin, cyclin. Is it working? The pulmonary arterial hypertension will get better. Okay. Let's talk about the side effects. So it's going to vasodilate. Well, it's going to vasodilate the arteries of the pulmonary vasculature. It's going to vasodilate other arteries. If I vasodilate, relax the arteries, what does that do to the blood pressure? Decreases the blood pressure. Well, that's why I'm giving it for hypertension. Silly, because I got to decrease the blood pressure, right? Okay. So it may decrease the blood pressure more than I want to. So from good blood pressure, now I'm going to become hypotensive, low blood pressure. So now let's do some critical thinking. If I'm giving you a blood pressure that's low, okay, and in the same room I put in this drug, I love Prost, which causes low blood pressure. Well, what do these two things have in common? Low blood pressure. What am I going to get? Really, really low blood pressure. So again, if I'm given a patient in a setting and I have to give them iloprost and the patient has low blood pressure to begin with, let me confirm things before let me shore up things. Let me see where things are before I give this medication. Do I need to call somebody? Do I need to notify somebody? Do I need to withhold this medication? What do I need to do? Right? But either way, I give iloprost with the low BP already, I'm going to have an issue. Right? That's critical thinking right there. Flushing, headache, and cough. Cough we see a whole lot of in terms of percentage side effects. Call the provider for that one. Another one that you get to see, and this is true for a lot of pulmonary hypertension drugs. So remember this. So whenever I try to relax the blood vessels of the pulmonary area, pulmonary vasculature, there's a likelihood that that may increase the congestion or increase the volume of blood in these blood vessels because I'm relaxing it, right? Because if I'm keeping it tight, it's going to move the blood forward. If I relax it, the blood's going to be less likely to move forward, right? Especially um, in the veins, in the pulmonary vein, which is further away from the right side of the heart. So remember, this is right ventricle, right? This is pulmonary artery. It goes through some stuff, comes back through. Now your pulmonary vein, which goes into what? Again, goes finally to the right, to the left ventricle, right? So again, it's easy to squeeze the blood through the pulmonary artery because you've got the force. But when it comes here, the force is no longer as high as it is when it's closer to the right ventricle. And so if the blood vessels aren't having a good tone, it's going to hold on to a lot of fluid. When it does, it increases the hydrostatic pressure and increases the leakage of these vessels. And when they leak, it goes into the alveoli. When it goes into the alveoli, now you start to hear crackles and you start to get pulmonary edema, fluid in the lung. Big issue. Got to call the provider for this. One can actually, the provider can order an x-ray and they can look at venous congestion on an x-ray. Okay? So again, that's something to remember. Again, with this drug, we cannot abruptly withdraw this drug. If we do, they get rebound pulmonary artery hypertension. It comes back with a vengeance. Okay? So these are some of the side effects of this drug. Let's keep moving. PGE1. What does that do? Remember, PGE1 increases the acid, right? And decreases so causes what? Smooth muscle contraction. Okay? Sorry, it causes smooth muscle dilation, relaxation. Okay? So again, it decreases acid, and causes smooth muscle dilation. That tells you how old I'm getting. PGE1. Um, okay? So again, Misoprostol. It's a prostaglandin drug used to decrease acid and increase relaxation of the smooth muscle. By decreasing acid, it's going to help with peptic ulcer disease and GERD. And by relaxing smooth muscles, it can cause dilation of the cervix. It's great during labor and delivery. How does it work? Stimulates PGE1. How do I know it's working? Symptoms of GERD or peptic ulcer disease are going to be better. And if it's given for cervix, and usually it's given in as a suppository or a vaginal suppository. So if it's given in LD, one can assess the cervix and see that the cervix has effaced and dilated. Okay. Side effects. Diarrhea and abdominal pain is a major side effect. Again, women of childbearing age, because of its effect on cervix, okay, we got to be very careful giving it to female of childbearing years because they could be pregnant and this can impact their pregnancy. So they need to be on a contraceptive, and usually the providers consider other options when it's female of childbearing years. Let's do some critical thinking. NSAIDs or corticosteroids. What do these two drugs do? Peptic ulcer disease and GERD, they're very harsh on the stomach. Well, if I give this drug, this will do what? Decrease the symptoms of peptic ulcer disease, GERD. Aha! And actually, you're going to see this drug used a lot for that purpose in your patients. Okay? So that's PGE1. There's another PGE1 which is very, very interesting. Okay? Very, very interesting. This is PGE1 agonist and it's called Aprostatel. Prostaglandin. You guys are starting to see the pattern? Alloprost, Misoprost, Aprost. Okay? Again, it's a PGE1 agonist. So what's going to do? Relax the smooth muscles. Well, this one relaxes the smooth muscle or blood vessel that feeds blood into the penis. Okay? So what does that do? Well, the penis has got two big reservoirs. And when the blood fills it up, that's when you get an erection. So again, it increases the inflow of the blood by dilating those blood vessels, and because of that, these two chambers of the penis, they get engorged with blood, and the male has an erection. How do you know it's working? Well, they're going to have erection, and they're going to state that now their erectile dysfunction is better, which is what it's used for. Side effect, flushing and penile pain. Okay, excellent. See how easy this is? Okay. So we talked about PGE1, right? What about PGE2? So again, you have dinoprostone. Again, another pros. You getting to see the pattern? What does it do? It, so remember, PGE1 is smooth muscle relaxation, right? Smooth muscle relaxation, decreased acid. PGE2 is opposite of PGE1. Man, it's gonna make that smooth muscle contract like crazy. You give this medication, it makes the uterus contract. Hey, it's used to induce labor. Side effect? Well, guess what? It's going to make that uterus get stimulated, can be hyperstimulated, so watch out for that. Dinoprostone. Okay, let's take a look at a couple of other drugs. Almost home. The pros drugs. Okay, PGF agonist. Carbopros. You guys see this pros again? Oh man, I'm telling you. Increase uterine contraction. PGF is another one that stimulates that smooth muscle. Okay. And it's another drug that is used to induce labor. Okay. Now it contracts these muscles, right? So let's say somebody's delivered a baby and they're hemorrhaging. That uterus is not contracted, right? So I give this drug, it's going to contract, and it's going to make these lumens, these blood vessels, they'll get clamped down, right? As the blood, and whenever the muscle constricts, it's going to come, the fibers are going to come close to each other and clamp this bleeding. So it can also be used for postpartum bleeding because it helps us clamp the blood vessels in the uterus, which is now contracted because of this drug. Well, also can constrict the smooth muscles of the blood vessels, so it can increase the BP and may cause nausea, vomiting, and diarrhea. Latanoprost, pros, eyes. Again, increase, so again, stimulates the PGF in the eyes. And there's a mechanism for it. The easier way to remember it is that it increases the outflow of the fluid in the eye, thus decreases the intraocular pressure. So it's used in glaucoma. One of the fun things it does is it increases the length of the eyelashes. Now, this side effect is very well liked by the people. Okay, so that's something that they like a whole lot. So there's some cosmetic benefits to this drug. And then the other one is hyperpigmentation of the iris. Okay. I think we have covered all the medications in this category, except one. We saved the best one for last, which is prostaglandin E5 antagonist. So what does prostaglandin E5 do? decreases the nitrous oxide. And nitrous oxide decrease leads to vasoconstriction. If you inhibit prostaglandin E5, okay, you increase the nitrous oxide and you cause the blood vessels to vasodilate. Okay, so do we have drugs? Viagra, sildenafil. That's the prototype, and there's a few more. What's the drug used for? Well, it vasodilates the blood vessels. So if you have pulmonary artery hypertension, it vasodilates the pulmonary artery, decreases pulmonary artery hypertension. Same thing with the penis. If it dilates the blood vessel, more blood flows through. The chambers in the penis get engorged with blood, and now the person is having erection, or their ED was treated. Erectile dysfunction was treated. Great, that's what it's used for. And this medication gained a lot of notoriety for erectile dysfunction treatment. Now, are there some side effects? Well, the penis may get engorged, but after a certain period of time, it needs to lose the erection. Well, what if a male doesn't lose that erection and it goes on for greater than 6 hours and starts to cause symptoms? That's called priapism. It's an emergency. And usually in the ER, some of the maneuvers may be tried, but one of the things that might be done is to actually drain the blood from the chambers. And that would need to be done, or that might there might be some permanent damage to the penis. So again, this is an emergency. One may have hypotension, right? Makes sense because again, you're vasodilating. Pulmonary edema. Well, why is that? Remember we talked about pulmonary artery hypertension. So on the venous side, if we dilate these blood vessels become engorged with fluid, they start to leak out that fluid. And then that goes into the lungs and that causes pulmonary edema. Again, that's an emergency. This is something interesting that we started to see in the ER. Who takes the Viagra, or who is the population that was most taking the Viagra at one point in time? These were older males that were suffering from ED. Guess who was having more MIs? Which age group has more MIs? So it's the older, and males have more, MIs, especially since they're not protected by the way the females are with the hormones. So these older males would go to ED with chest pain, and they'd taken this drug, a few hours ago for erectile dysfunction. Well, we would give them nitrates or nitroglycerin for MI. Remember Mona, morphine, oxygen, nitroglycerin, aspirin. So they'd get their nitro. Well, so what happened? Well, this drug inhibits PGE5, which leads to increased nitrous oxide, and nitroglycerin gave them more nitrous oxide. Man, they got so much nitrous oxide, they vasodilated like crazy, and their blood pressure dropped like crazy. So now, when a patient goes into the emergency room, we generally ask them about drugs and other medications and whether they've taken a drug like this in the past few hours. And if they have, then that alters our treatment plan with nitroglycerin. So a couple of other ones which are interesting. There's hearing loss and vision loss. And again, those two, if that happens on this drug, that needs to be sent to the provider. That's an immediate concern. Okay. So let's take a look at these drugs again. So again, we are talking more about the prostaglandin drugs. So we start with PGI, iloprost. Remember pros? And that's the theme you're going to see in most of these medications. So I for PGI, right? And then pros for prostaglandin. So again, it's a prostacyclin agonist. Essentially vasodilates and decreases plate clumping of the platelets because it's cyclin. Okay. Used for pulmonary artery hypertension. It can cause hypotension and pulmonary edema. Then also kind of watch out for abrupt withdrawal, headache, cough, and flushing. You have misoprostol, which is PGE1 agonist, decreases the acid, smooth muscles, helps them relax. So decreases acid, helps with GERD and peptic ulcer, relaxes smooth muscles, cervical dilation. So again, helps with L&D, labor and delivery for cervical dilation. So again, we have to be careful with female of childbearing years, and usually providers consider other options. This misoprostol can be used in combination with other drugs that may be irritating to GI tract, like NSAIDs and corticosteroids. We have Aprostatel, which is another prostaglandin, which is PGE1 agonist. Again, dilates artery of the penis, so increases blood flow, increases erection, helps patients with ED. How do I know it's working? Well, and then again, flushing and penile pain are two side effects. You have PGE2. Now, PGE2 is more inflammatory. PGE1 is more relaxing, right? PGE2 is more inflammatory. So it causes smooth muscle contraction used to induce labor. And the issue could be uterine hyperstimulation, okay? PGF, another contractor, contracts the uterus, induces labor. Well, once the labor is done, we need to contract the uterus, we can give this drug. The uterus contracts and clamps down on the blood vessels and stops postpartum bleeding. Increases what? The blood pressure, increases nausea, vomiting, diarrhea. Can be used in the eyes for treatment of glaucoma or managing or increasing length of the eyelashes, which is one of the side effects along with hyperpigmentation of the iris. And the last drug we talked about was the PGE5 antagonists or blockers. PGE5 decreases nitrous oxide and causes vasoconstriction. So by inhibiting uh, PGE5, we increase nitrous oxide and cause vasodilation. Vasodilation increase will give us more blood flow, causes erections to happen in ED patients, erectile dysfunction patients, or vasodilation decreases the blood pressure in pulmonary artery hypertension. The drug Viagra of sildenafil, side effects, priapism, the erection happens, doesn't go down. Hypotension in the ER because it's relaxing the blood vessel. It has drug interactions with nitroglycerin, which causes so much nitrous oxide it dilates like crazy. You can have hearing loss and vision loss. And again, pulmonary edema, which is one of the common ones. And so these would be some of the combination drugs in terms of the prostaglandin, some of the important ones.